Good evening and good afternoon, everyone. Thanks for joining us today for this educational webinar on open enrollment. I just want to let you know that your lines are muted. And I'd like to introduce myself. My name is Shika Dunyo. I am the Director of Education Programs, and I will be the facilitator for this webinar today. First, before we get started, I'd like to thank our sponsor, Strongbridge Biopharma, for making this webinar possible. And so now that we have that all out of the way, it is my great pleasure to introduce my colleague and our first speaker, Mel Meyer. Paul is the Director of Federal Policy here at NORD. In his role, Paul works on legislative and regulatory advocacy at the federal level. He also engages with the FDA and the NIH to ensure that the patient voice remains strong in drug development and that there is continued research being done on rare diseases. Prior to joining NORD, Paul worked at the Center for American Progress, AARP, as well as in the United States Senate. So Paul, the floor is yours.
Thank you very much, Shika, and good evening, everybody. This is Paul Mel Meyer, the Director of Federal Policy here at NORD, and I want to just really go over the federal aspects of the health exchanges and open enrollment, and really just try to fit everything that you need to know about open enrollment into the next hour or so. So before getting into the specific, let's just back up a little bit and talk about where this all came from, essentially, which is the Patient Protection and Affordable Care Act, PPACA, or the Affordable Care Act, Obamacare, call it whatever you'd like. It's a monumental legislation passed back in 2010 that did many things. And within this legislation, we see the marketplaces being set up and kind of a new venue for purchasing health insurance from private insurers with assistance from the federal government, largely through the form of premium subsidies as well as cost-sharing reductions. We see an expansion in Medicaid, namely expanding into populations that are able-bodied adults but are of lower incomes. Currently, we have 33 states that have expanded Medicaid, as well as Washington, D.C. This is actually an old graph from a couple years ago, which is why I had to update the number there. We've had a couple states expand since this was put together. And then there were several other provisions, actually many other provisions within the Affordable Care Act that are incredibly important to the rare disease patient community, including patient protections for individuals that protect them against discriminatory insurance practices, including new programs to care for individuals within the home under the Medicaid program, including the closing of the Medicare donut hole, expanding allowance for coverage for individuals up to 26 years of age under their parents' plan. So all sorts of things within the Affordable Care Act. But what I want to talk about today is really the focus on the marketplaces, and then I'll touch on Medicaid as well. And the reason that I want to focus on the marketplaces is because it's open enrollment. Happy open enrollment, everybody. Starting on November 1st, open enrollment started in every single marketplace across the United States, including the federal marketplaces, and it is set to close federally on December 15th. I'll get a little bit more into that a little bit later, and then Tim Boyd, our Director of State Policy, will discuss how this is different in some of the states. So the way that the Affordable Care Act marketplaces are structured are that there are options that states can take. They can pursue kind of different ways of setting up a marketplace. And this is the current lay of the land of how this currently looks. So as you can see, all of these latest of blue states are the federally facilitated marketplaces. This means that the state essentially said, no thanks, federal government, you do it entirely yourself. We don't really want to be involved. You set up the website, you set up the process, you take care of it. The next darkest blue, I guess the next in line here, are the state-based marketplaces, and that's actually the reverse. The states have said, no thanks, federal government, we want to do it entirely. We don't really need your help. We want to do it. We want to set up our website. We want to set up our rules. We want to set up the process. We want to give it our own name. And so you see that in states like California and Colorado and Washington, Idaho, New York, Washington, D.C., some of the other states in New England, and so forth. There are a handful of states that have kind of chosen a hybrid model in which the state will kind of administer the back-end functions essentially, but they'll do it on the federal platform. And then there are even more kind of nuanced relationships between the federal government and states partnership marketplaces. But for my part of the presentation, I want to talk about the federally facilitated marketplace as well as the state-based marketplace that are on the federal platform, because both of these are hosted on healthcare.gov. Now, that doesn't mean that those of you who live in states that have a state-based marketplace should not go to healthcare.gov. Healthcare.gov will actually direct you wherever you need to go. Doesn't matter if you're in a state with a state marketplace, a federal marketplace, a hybrid, doesn't matter. Healthcare.gov will know where you're supposed to be, and it will send you where you're supposed to go. So here is the just healthcare.gov opening page here, and you see there's several options, and we are going to go through the process to apply. But just before I do that, a couple things to note here. Again, you got to act by December 15th in order to sign up for insurance under the federal marketplaces. There's a process for creating an account, which I'll go through as well, and there's also a find local help function, which I'll discuss a little bit later on in the presentation. Okay, so we're going to start the process for applying through insurance through the marketplaces. So first you got to create an account and select your state. And as you select your state, if as I did, I live in Washington, D.C., so I would click this button, choose the Washington, D.C., and then it would say, well, hey, look, your district technically has its own marketplace, so we're going to send you over there. But if you select a state that is run through the federal marketplace, then you would continue on healthcare.gov. So for me personally, I did set up an account, and these are screenshots from when I did it through my old home in Pennsylvania. And the next step here is, once you set up your account, is to start an application. And as you set up an account, it's very similar to setting up an account for other services, name, email, address, all that kind of good stuff, just as you would for other websites if you were to set up an account there. Now, the application is rather much more comprehensive, actually, because it requires a lot more information to know what would appropriate insurance be for you, as well as what subsidies you would qualify for, as well as whether you can't access insurance through Medicaid and other insurances, because that is a requirement that you're unable to access through Medicaid first, as well as Medicare. So if I was to click on this green button, it would actually first send me to a link to a PDF, which is this PDF right here. I really can't recommend it strongly enough. This is www.healthcare.gov/downloads/application-checklist.pdf. And the reason that I have this on here, and this is really probably bad form for a webinar since I don't think you can click on that, but maybe you can scribble it down in time before I move on. But this is really the comprehensive list of what you need to have on hand when applying for insurance. It'll say you need this, you need that, you need this information, you need that information, and you won't need any more and you won't need any less. But it is really kind of a very good comprehensive guide for what you will need in hand as you get ready to apply for insurance on the marketplaces. All right, so I'm going to actually move away just for a second from screenshots from healthcare.gov just to talk a little bit about what you need to keep in mind as you're considering different plans. And I'll show you what this will look like on healthcare.gov, but first I want to cover these specific points. So when you're considering an insurance plan for you or your family, first think about the formulary. And when I say what a formulary is it is what drugs the insurance plan will cover, and what is missing on that formulary they will not cover. So essentially, if the therapy is on the formulary, then it will qualify for coverage of some sort, whether it be a copay, you'd be required for a copay or coinsurance or any kind of cost sharing there. But if it's on the formulary, then the insurance company will be covering at least part of the cost of that therapy. If it's not on the formulary, then it likely will not be. So as you are shopping for insurance, it's very important to determine first and foremost that that specific plan has under coverage the therapy for your rare disease. In addition to the formulary, it's important to look at the benefit structure. Not only is it important to make sure that the therapies are covered, but it's going to be a very big difference if you're comparing plans. If one plan will require a $5 copay for that therapy, whereas another plan requires, let's say, a 50% coinsurance, and this could be a really expensive drug. That could be hundreds of dollars. There's a really big difference between that. And the benefit structure for each of these plans is also laid out on healthcare.gov so that you can kind of compare and contrast and make sure that you're not going to be really kind of hamstrung with incredibly difficult cost sharing that you didn't really anticipate beforehand because you didn't make sure that that wasn't going to be in the case that in the plan that you chose. Not only is this important for therapies, this is important for all kinds of benefits within the plan. That includes doctors in-network and out-of-network, that includes hospitals, that includes prevention care, includes all sorts of things that can be different for the most part across insurance plans. There are some regulations within the Affordable Care Act that require prevention care to actually be offered with no cost sharing. That includes one primary care visit per year. That's your annual checkup. But for the rest of the services, including specialists, including lab tests, including any other kind of therapy or care that you'd be accessing, it's going to depend how much the insurer is going to be asking you to chip in. And so that's what I mean by cost sharing structure. It's also important to note if your docs are going to be in-network or out-of-network, as well as your hospitals are going to be in-network or out-of-network. Oftentimes these plans have very substantial out-of-network cost sharing. They might not even cover it at all. And so it's important before purchasing insurance that you are able to determine that your docs are actually within that network. And I'll talk about how to determine this here in a minute. And then finally, just important to determine what the maximum out-of-pocket limit is, because it actually can vary across different plans. There is a maximum that plans are not allowed to go over. For individuals, it's about $7,000 per year. For families, it's about $14,000. So many plans will just kind of run up to that limit, but there are actually many others that will have an even lower limit. And so that also plays into the benefit package that you would choose. Now, not on this slide is kind of the trade-off between deductibles and premiums. And generally how insurance works is the catastrophic or bronze plans that you could purchase on the healthcare exchanges will likely have very high deductibles, but perhaps lower premiums, but they'll also be covering lower. So essentially, they're asking you to chip in a lot more for your care, but you get to pay a lot less monthly. So these are generally more popular in healthier individuals or younger individuals. For those who need more comprehensive care, or you have a lot of docs to go to, or need several drugs, you're going to want to be sure that those are covered, as I said, and that's going to largely be found within silver or gold or even platinum plans within the exchanges. And now in those plans, you're going to face higher premiums because, frankly, it's covering more. But generally, there's kind of a trade-off between the higher the premium is, the lower the deductible, and vice versa. Now, that isn't always the case. We see deductibles going up generally. We see premiums going up generally. But it's important to understand that trade-off, that the higher premiums are, that likely means the more coverage that there is within the plan, and thus the deductible could also be lower, and then kind of vice versa with all of that. Okay, so I'm going to move on to another screenshot from healthcare.gov. So at this point, I have filled out all of my information. I've filled out everything that I need to cite when applying for a plan. That would include my yearly income. That would include my Social Security number. That would include other pieces of important personal information for the federal government to be able to identify who you are, what you qualify for, what is the best plan for you, because they want to be able to craft the best plan for you. So when enrolling in a health plan, you'll go through these steps. So first you report tobacco use, very easy, yes or no question essentially. And then after that comes one of the most important parts of all, and that's to see if a plan covers your docs, hospitals, and prescription drugs. Now, if I was to click on that right there, then there would actually be a search bar that you can type in who your doctor is. You just type in the last name, and then a whole list of doctors will come up. You'll click the doctor that you have, and then that will be input into the system. Same goes for a prescription drug. If I wanted to put in an orphan therapy within that search box, and it would say, okay, so I want to take this orphan therapy, so I'll put that in there. I'll click on it, and then what that will allow the system to do is it will allow them to know what docs and drugs you need to have covered within your plan, and then we'll be able to tell you if that doctor or drug is covered within your plan. So if I was to complete the tobacco use part, the C plans that cover your doctor, get an estimate of your yearly cost, and then now I'm at Choose Health Plans, this is what it would look like. So as I said before, now I'm back in Pittsburgh, Pennsylvania, because that's where I'm from, and this is what the quick description of the plan would look like. So you'd see the monthly premium on the left. This is a silver plan, meaning that it is the most popular plan. Essentially, it's kind of the middle ground in a sense of how plans are. It's not the skimpiest, but it's not also the most comprehensive. So here we have a monthly premium of $280 per month, an individual deductible of $3,500. You see that out-of-pocket maximum there of $7,350. Next to that, you see the co-payments and co-insurance. And again, this is important to keep in mind because this can vary drastically across different plans. Here I see if I want to access a specialist, let's say it's an endocrinologist, or it's a certain pediatrician, or it's a dermatologist, someone who's not your primary care doctor, essentially, that's going to cost you $75 per visit. For your primary care doctor, $25. Generic drugs, $20. Now, not listed here, you see, are other, non-generic drugs, so brand drugs or specialty drugs. That's likely buried deeper within the plan. You can find that out as well if you clicked on this. Also, you'll see the co-payment for emergency room care. Now, as you filled out that application before, you also filled out what your estimated total yearly costs are, meaning what you would expect to incur. So how often you go to the hospital, to the doctor, to take certain drugs and so forth. Now, I very casually did this. I had no rhyme or reason to what this is, and somehow it shot out $9,631. Not sure how we got there, but that's because I just did it within 30 seconds, essentially. And if you were to do it comprehensively, it actually would show a pretty accurate estimated total yearly cost under this plan for you. Now, what I did do is I put in one doc and one prescription drug on the right side here. And you see the one doc that I put in, he is covered under this plan. The one prescription drug that I put in is not covered under this plan. Now, if you were to click that change button right there, of course, you could change or add drugs. You could see, okay, well, maybe that one doctor isn't covered, but maybe this other one is. Kind of play around with it just to make sure to see who's covered and who's not, and what's covered and what's not. Now, not only can you look at this page for the specific plan, you can also compare different plans. And so I compared here that same silver plan as before with a gold plan available on the Pennsylvania marketplace. And you can see I can compare monthly premiums. On the right, the gold plan has substantially lower deductibles as well as a lower out-of-pocket maximum. Co-payments and co-insurance are different, and at the end here you see the estimated total yearly costs are different as well. Now, I can't explain to you why that it's this drastically different, but this is a really good example of just how much variation you can find within the marketplaces and why it's really important to shop carefully, essentially, and make sure that make sure that it is the right plan for you. So one final slide for me before I turn it over to Tim to discuss the state exchanges. On healthcare.gov, right at that beginning slide, quite literally the URL of healthcare.gov, there is the option to find someone nearby to help. So you just put in your zip code here, hit continue, and then a whole list of individuals who are generally trained insurance brokers or navigators will pop up in your local area. There'll be a map. There will be a listing of their names and phone numbers and emails and folks to reach out to if they need some help, a little extra help working with the healthcare.gov. And frankly, it can be confusing. These folks are trained. They've gone through extensive training to make sure that they know what they're talking about, and that they're there to help out. Okay. So I'm going to turn it over to our Director of State Policy, Tim Boyd, to discuss the state exchanges and how that works, because it is a bit different. Tim, in his role, is responsible for our public policy operation for all 50 states. Prior to joining NORD, he worked in the HIV/AIDS policy space on federal, state, and global policy. So I'll turn it over to Tim.
Hi, everyone. So I'm going to run through some important kind of caveats, essentially, to what Paul presented when it comes to states that have set up and are running their own marketplace. And as Paul pointed out, there are 11 states in D.C., you can see listed below this slide, that operate their own individual market. These states do not use the Healthcare.gov marketplace for enrollment. They have their own websites. However, when you go to Healthcare.gov, and if you're in one of these states, as Paul mentioned, they will direct you to that state page. So you don't have to worry about getting confused. If you go to Healthcare.gov by accident, you'll still be redirected to the right place. And a lot of these states have names and logos that you may have heard of and not realized it was a healthcare exchange. On this slide, you can see what all those 11 states, or 12 if you count D.C., what their program is called. So things like Access Health Connecticut, Covered California, New York State of Health, Mass Connect, things like that. So each of these states have branded not only just their website, but their entire marketplace program. So just a couple quick things for you to know about the state exchanges when you go, if you live in one of these states and you're enrolling through the marketplace. Their process in general is very similar to the Healthcare.gov structure. It's going to ask you a lot of the same questions, but it may ask you more specific questions about your healthcare and cost and employment and things like that. In addition, states that run their own marketplace and run their own exchange can have more say on which insurers participate and require benefits beyond the federal law. So all the states that are participating, or essentially that outsource their work to the federal marketplace, they all kind of operate under the same rules. States that run their own marketplace can go above and beyond what the federal law requires and what is offered on the federal marketplace. So what that means in practice is that some states can choose to limit the number of insurers that can participate and be more selective about the plans they offer in their marketplace versus simply allowing every insurer that meets the benchmark requirements into the market. That authority, that autonomy allows states sometimes to operate with more, to do some interesting things with plan design and bring certain plans into their marketplace that to meet specific needs. So for example, in a state that they feel like they have more of a diabetes need, they can find more plans that have a specific diabetes benefit. So what that means for you, if you are in one of these states that operates one of its own marketplaces, pay closer attention to the different plan types being offered. They may have specific benefits that are more important to you than to, say, other enrollees. In addition, if you are on medications that tend to be expensive, pay attention to those differences that may exist in those state plans. However, aside from those main differences, most of the things that happen between states that run their own exchanges and the federal government tend to happen behind the scenes, so you will not notice them as a consumer purchasing insurance. So, for example, that same silver, bronze, gold, platinum structure that you see on the federal exchanges exists on the state exchanges as well. And again, it's important to reiterate that if you go to Healthcare.gov, instead of your state exchange, you'll still be redirected back there. In addition to that, if you Google your state exchange, that usually it's the first one or two results that pops up. So it's pretty easy to identify and find these state exchanges if you live in one of those states. And again, I'll show that list again right here so you know if you are in one of these states. In addition to that, one of the other major changes between states that run their own program and those that do not is that state exchanges are able to set different enrollment deadlines or later enrollment deadlines in the federal government. So for everyone else, the enrollment deadline is December 15th. In some states, they can push that all the way to mid or late January, and you have much more time to enroll. So when you're in one of these states and you're looking at those enrollment deadlines, pay close attention because you may hear a lot of stuff and a lot of communications, certainly some of it coming from NORD, referencing December 15th, December 15th, December 15th, whereas in your particular state, there may be a later deadline. In addition, throughout the exchanges, not just states that run their own marketplace, there are exceptions to the deadline. For example, if you live in Texas, Florida, or Louisiana and were affected by one of the recent hurricanes this year, there is an extended enrollment deadline. There are also, if you have personal situations that come up for your own family, that sometimes can qualify you for an extended enrollment. So there's just a few of the issues that are unique to states that operate their own exchanges. I'm now going to throw it back to Paul to cover a couple wrap-up items, and then we'll jump into some questions.
All right, thank you very much, Tim. So I just wanted to leave you all with just a couple points, kind of a couple takeaways, I suppose, that we really wish to emphasize. First of all, the ACA is very much alive, and it's still kicking. And there have been a lot of rhetoric out there that the ACA is dead, that executive orders or laws that have been passed or what have you have officially repealed or in some ways crippled the ACA so much that it's not even worth going and looking at healthcare.gov. And really our answer to that is that's by no means true. There are still plenty of options out there. And actually what we've seen within the last, let's say, 15 days at this point is 1.5 million individuals signing up for healthcare coverage through healthcare.gov, which is actually just as much, if not more, than in prior years. So it's actually quite evident that the Affordable Care Act and the coverage that it can offer through the exchanges as well as through Medicaid is still very much available. And something I want to emphasize that the ACA is also much more than just the exchanges and Medicaid. Both of these are incredibly important coverage expansions, but we have to remember all of those incredibly important insurance protections that were also covered within the ACA. I like to remind people that it's called the Patient Protection and Affordable Care Act because of all those patient protections in there, yet those patient protections are oftentimes forgotten. And when I talk about protections, I mean community rating, mandating that everyone pays the same premium within the plan, or guaranteed issue, meaning that an individual with a pre-existing condition can't be refused insurance just because they have a specific diagnosis. All sorts of different important protections. So as I mentioned this earlier, that you can also check your eligibility for Medicaid through healthcare.gov. As you are filling out that application, which includes your yearly income, it will check to first make sure you're not eligible for Medicaid. And actually there are a lot of individuals who go to healthcare.gov or go to their state exchanges and find out that, hey, I was eligible for Medicaid all along, or that I'm eligible for the Medicaid expansion. And so at that point, then you'd be rerouted to the Medicaid options, and then you can qualify and sign up for Medicaid. As I said before, the deadline for the federal exchange is December 15th, so you have about a month to sign up still. And you are purchasing insurance for a calendar year 2018, meaning this insurance, if you were to purchase it, would start on January 1st and would continue through the end of the year, so through December 31st of 2018. All right, so those are really just a couple of the main takeaways I wanted to be sure that I emphasized here at the end. With that, I'm going to turn it over to Shika.
Excellent. Thank you so much for your presentations. Very informative. We have collected a few questions. If you do have any other additional questions, you still have time to submit those. And if you are only logged into the phone call, feel free to email your questions to policy@rarediseases.org, and we will try and answer those as well. But Paul and Tim, we've queued up all the questions, and so if you could go through the questions in the questions tab and answer those if they're relevant to the topics of the conversation.
Sure. And Paul, I'm going to start with one that I'm not sure we covered effectively enough so far, but can you talk a little bit about that metal tier structure that exists within these plans, what that means on a layman's terms, and maybe a little bit of what's going on behind the scenes there, but essentially how that affects consumers and what they have to be thinking about when they see that metal tier structure.
No problem at all. So what the Affordable Care Act has done is it has tried to essentially simplify the way to qualify the comprehensiveness of an insurance plan. So essentially, how comprehensive is this plan? How much is it going to cover for me? And it does that through something called actuarial value. Actuarial value essentially, and it gets really esoteric really quickly, so I'm not going to get too far into it, but Essentially, it's if you have, a certain amount of costs in any given year, what percentage of those costs will be covered by the plan. Now, these are called metal tiered plans, as Tim already alluded to, bronze, silver, gold, and platinum, and they go up in their actuarial value. So a bronze plan has a 60% actuarial value, which again essentially means that the plan is expected to cover 60% of the cost of your health care for which you apply for coverage. A silver plan is at 70%, a gold plan is at 80%, and a platinum plan is at 90%. So this is solely based upon comprehensiveness. Now the plans will be priced based upon their comprehensiveness. So you'll see the bronze plans are the cheapest because they will cover the least, most often.
Cheapest in terms of premiums?
Cheapest, well, in combining premiums and deductibles. There are different ways that the insurance companies can, as I said before, that kind of relationship between premiums and deductibles. There are different ways it can get at it, essentially, as well as the cost-sharing structure. But in the end, you would be essentially expected to pay for 40% of your health care under a bronze plan, and the insurance company would be expected to pay for 60%. Now, that's a gross oversimplification, but it can boil down essentially to that. And it continues with the rest of the metal tiers. The insurance plan covers 70 under silver, you'd cover 30. The insurance plan would cover 80 under gold, you'd cover 20, and so forth.
So one thing to keep in mind when you're looking at these metal tiers and you're comparing plans in your state is that you may see two plans and everything looks pretty comparable in terms of the network, the benefits, but you may notice that like one has a much lower premium. That's when it's important to pay attention to the metal tier. That's when you might want to make sure you're looking at the deductible and understanding that aside from that monthly premium or yearly premium, there may be higher costs that you have to pay once you start accessing care. So, Paul, a first question we got from Amy, Eve actually, was asking why we've seen a lot of reporting this year on deductibles and premiums and all these things going up. Why is that happening? Why are plans in this marketplace costing more every single year?
So there are a couple of reasons for why premiums and deductibles have been rising in many states and within many plans, but that's not uniform. There are actually several states that have seen premiums and deductibles go down within those states, but that by no means means every plan nor every state. It really kind of varies upon your specific location and specific plan. But the reasons for why we've seen premiums and deductibles going up in some states and in some plans, and likely a majority of them, are due to several reasons. The first is because the Affordable Care Act has one major flaw. Well, it has several flaws, but one of the biggest is that it has not done a good enough job in incentivizing healthy individuals to sign up for insurance. And so when the Affordable Care Act was first created, it was anticipated that those who have higher healthcare costs and have more healthcare needs would sign up, but also a lot of healthy people, a lot of young people, a lot of folks who will be paying their monthly premium and as well as paying their deductible, but perhaps not incurring particularly high medical costs. And so in the end, these healthy individuals paying into it would kind of outweigh the sicker individuals paying into it, so that premiums and deductibles would stay rather consistent. Now, unfortunately, that hasn't been the case because the healthier people haven't been signing up at the rate that they should be. And this can be kind of posited for several different reasons. Perhaps the individual mandate hasn't worked as it should have. Perhaps advertising and enrollment hasn't worked as it should have. Perhaps that debacle, remember that healthcare.gov debacle from back in 2014 where it basically didn't work for a month? That actually is still having effects. So all sorts of different reasons for why healthier, younger individuals aren't signing up, and thus it's more often the sicker individuals signing up, thus driving up the premiums and deductibles within the plans. In addition to that, this year we actually saw the Trump administration, actually was within the last month and a half or so, choose not to continue with the appropriation of the cost-sharing reduction payments, and with that came a approximate anywhere from about 10 to 25% increase in premiums really across the board, because these cost-sharing reductions were really important in assisting with the payments for individuals of low incomes who needed a little extra assistance with lowering the cost sharing for their therapies or for their doctors or their emergency room. Now, without those, the insurance company essentially has to eat those costs, and so they're going to raise premiums as a result. And then finally, the markets are still not particularly stable right now. There are still a lot of ambiguity for insurers on who's going to be signing up and how they're going to be signing up, and if enough people are going to be signing up, and if there's a commitment from the federal government or state governments, or if there's not. And that ambiguity can be really shown within them just kind of putting higher premiums because they want to just cover themselves. They want to be sure that they're going to do their best to not lose a lot of money at the end of the year. And if there's going to be a whole lot of ambiguity on federal regulation and rules and federal support and state support, and if there's going to be enough folks signing up, they're going to just charge higher premiums to try to cover that possibility. So all sorts of different reasons for why we see premiums and deductibles higher right now.
So, Paul, another question kind of factors into that was asked is we see the tax reform bill is now proposed to remove the individual mandate, the tax penalty for not having insurance. Is that going to have an impact on premiums this year for people enrolling right now?
No, it will not. And that is because the IRS and the marketplaces and so forth are all working under a set of rules that have been applied prior to this current tax debate. It's my understanding that if tax reform was to be passed and the individual mandate was to be repealed, that everyone signing up for insurance now is still going to have insurance next year. They're not going to be able to unenroll because the individual mandate was repealed before January 1st. However, after this year, it would have a substantial effect. It's estimated by the Congressional Budget Office that 13 million fewer individuals would have insurance if the individual mandate was repealed. Now, many of these folks are individuals who would choose to no longer purchase insurance because they wouldn't be facing the tax penalties that they otherwise would have faced under the individual mandate. And then there are other many individuals who we represent who would be facing substantially higher premiums because these healthy individuals would no longer be signing up and then couldn't afford their insurance any longer because it'd simply be priced out of the market. And so that's how you end up with 13 million fewer individuals with insurance if the individual mandate was to be repealed, which is why we're not supportive of that. We're opposed to them doing that because incentivizing healthy individuals to sign up for these marketplaces is really critical to making sure the entire thing works. And to repeal that would only cripple the marketplaces further.
So next question was about COBRA and what is the effect of someone who is on COBRA and whether or not they can enroll in the marketplace plans. And if this stumps you, I have a chart in front of me.
Tim, why don't you take it?
Sure. So the answer to that question is that if you have COBRA currently, you can change during open enrollment, you could switch off COBRA completely and onto the exchanges, and it will not affect the cost of your exchange insurance. If it is outside open enrollment and you have COBRA, you can use a special enrollment period, which means essentially enroll at any time if your COBRA is soon running out. However, if you're trying to end your COBRA early, you cannot use the special enrollment period. You have to wait for open enrollment. Or in addition, if your COBRA costs change because of changes your employer made or your coverage provider made, that also qualifies you for a special enrollment period. So actually, if you have COBRA, the only situation in which you cannot use a special enrollment period for the marketplace is if your coverage is just, you want to get out of it early and nothing has changed about it. In addition, if you have recently lost a job, that qualifies you for a special enrollment period, and you are allowed to enter the marketplace even if your employer is offering COBRA coverage.
But what you're telling us, Tim, is that since we're in open enrollment right now, everyone who is on COBRA could sign up for a plan through the marketplace right now.
Yes, if you have COBRA, you can go to the marketplace. No, it'll not cost you more money to join the marketplace than any other person.
There you go.
So another question about, do we know if we reach out for assistance if there will be a charge? And this one's pretty simple. If someone is offering to charge you for assistance enrolling in marketplace plans, don't listen to them. There are numerous, not only just government-provided free assisters to help you enroll in coverage. There are nonprofits like NORD which can help answer these questions. It will certainly never charge you for that. In addition, the insurance companies and insurance brokers who want you to enroll in their plans offer those services and guidance for free. So you should never have to pay for assistance in enrolling in a marketplace plan. Another question. Someone reports that their daughter is 21 and has a rare disease. Should they consider looking at a separate policy just for her or a family plan?
I mean, it really just depends on each of the plans, essentially. If it makes more sense to keep her on the family plan, and she can stay on that plan until she turns 26 due to the new rules within the Affordable Care Act, then I would just suggest comparing plans to see how the coverage is within the family plan compared to the individual plan, how much more the premium or deductible will be for the family plan if she is enrolled within the family plan compared to if she was to get her own personal plan. It really just depends on the specifics. This is where comparing the different plans really is important, because in some situations, staying on the family plan might be the best case. In others, going and having her own plan might be better. So it just depends on the specifics of each plan. Sorry, I can't give you a better answer than that.
So we got a couple of questions about deductibles and what exactly deductibles mean and what that means when you actually have the insurance. So one question was asking, if I have a $3,000 deductible, does that mean I have to pay all that money before my insurance kicks in? Essentially, yes, for a lot of services. However, on the marketplace, there are federal rules called the Essential Health Benefits and other rules that require some services to be provided independent of the deductible. So what that means, in almost every healthcare plan that you'll find on the exchange, things like regular doctor visits, checkups, a lot of preventative services are done independent of a deductible. The deductible will usually kind of kick in when you're doing services above and beyond a normal doctor visit, or if you have an emergency room stay. That's where you'd have to pay that deductible before your insurance kicks in. Anything to add to that, Paul?
Well, and yeah, to kind of move to build on what Tim said, if there are services that technically can be applied, pre-deductible in a sense. Let's say a primary care visit that will, let's say that plan we were looking at earlier, there's a $25 copay for that primary care visit. That could be pre-deductible. That you might not have to pay the entire cost of that primary care visit depending on the plan, but if you are not, that $25 copay will go towards your deductible. So you'll still be working your way through the deductible for services that technically do not apply to the deductible if there are co-payments or co-insurance or cost sharing of any sort.
And another quick follow-up to that, will plans on the marketplace sometimes have different deductibles for drugs versus medical care?
I do believe so, yes.
So another question about, kind of within this vein, the question from Simeon, are there plans on the marketplace that cover basic doctor checkups and his medications? And he's also asking about coverage of things like eyeglasses and certain dental services. So
yes, if one of the prior slides that I showed earlier was kind of those 6 different steps that you would go through when enrolling in insurance. You first had the check tobacco use and then kind of put in the drugs and doctors that you're going to require. So if you put in all of those therapies and physicians that you need covered under your plan, then you can really kind of roll out the plans that wouldn't cover any of those therapies or docs, so you can ensure that the plan you're purchasing would include those. Now also on that let's say 6-item checklist, lower down is the option to add a dental plan. And you can also purchase dental plans through healthcare.gov and kind of add that as a supplement to the insurance that you're accessing. Now optical plans, I believe it would probably depend on the specific plan. You'd probably want to look into it and maybe even call a broker and ask, does this also offer optical care? Some may not. I think it would likely depend on the plan. But that would be a great question for a Navigator or a broker or whomever you're calling, just to ensure that whatever you're purchasing would also include optical coverage as well.
There's a similar question in that vein asking about a question about specific plan networks and PPOs. And what's the best way to figure out exactly which networks may or may not exist within your insurance plan?
Well, again, I would encourage you to use that tool that allows you to type in your doctor to make sure that he or she is in your network. really type in any doctor that you have. Doesn't matter if he or she is a specialist or a primary care doc or emergent care. There's a pretty comprehensive database on healthcare.gov for all physicians for the most part, and that will help guide you on what network is included within that plan. And then also, again, I can't really emphasize strongly enough in calling a navigator or a broker to assist with this, because they know networks inside and out. They know how to find who's in a network and who's not. They would know what plan would be best for you depending on what healthcare needs that you have, and therefore would be able to ensure that the network would be adequate for you. Now, within the title of these plans, you'll see some are PPOs or other kinds of different structured plans. I wouldn't pay too much attention to that. I would just pay particular attention to just making sure that your doctors are covered within that plan using the tool that I went over earlier.
And that being said, jumping off on that, if you have a familiarity with an insurance network, say like a blue card PPO that you're very familiar with, or that your former employer had offered, something like that, and you're wondering like if the ACA has a comparable network, that's a great question for a broker. I would caution against the idea, if you see things with similar names, even if they're offered by the same insurance plan, they're not necessarily the same network. So that's very important to know, like when comparing things, especially if you're switching from two different forms of insurance, to know if you need what it covers and what it doesn't cover. All right, question about Trump. I'm just going to skip that. So I guess another question about premiums and how the calculation of financial assistance is determined. So I guess two-part of this question. One, how is the amount of financial assistance determined? Mm-hmm. And two, once that is all done, the number you are seeing on the exchange website, is that inclusive of everything, or is there a hidden cost you may be worried about?
So to answer the first question about whether or not you would qualify for financial assistance, so individuals whose income fall within 100% and 400% of the federal poverty line are qualified for subsidies through the Affordable Care Act. And of course those are tiered. The higher you go within that range, the fewer subsidies you qualify for. The closer you are to 100% of the federal poverty line, the more subsidies that you'll receive. And that will all be reflected after you fill out the application on healthcare.gov, because part of that application is your yearly income. And it will then tell you, congratulations, you're eligible for subsidies, and this much will be either taken out or lowered within your premium. This is your actual premium because you qualify for subsidies. Now, what's important to note is that these subsidies, this isn't anything that really afterwards you need to worry about. This isn't something that you need to do within your taxes or calculate yourself or anything like that. This is all done through healthcare.gov. So earlier, as I filled out my information for that plan that I kind of walked through the process for, I put an income that would have been higher than the 400% of the FPL, and thus the federal poverty line, and thus I did not qualify for any premiums, for any subsidies. However, if I had put one that was lower, that $283 would have been something like $200 or something like $150 or something that was lower, and that's where it would show up. That's where it would show up how much lower the cost of your insurance would be because of the premium subsidies. And again, that would all be calculated for you through healthcare.gov, and that would be based upon the income that you would put within the application. The second question was on the estimated yearly costs. That encompasses everything you'd be expected to pay. That's premiums, that's deductibles, that's cost sharing, that's co-pays, that's everything. So as my estimated yearly cost on that slide was a little over $9,000, that's adding up the monthly premiums, that's adding up anything I'd be expecting to pay within the deductible. And again, it's important to kind of be honest with the system and how much you're going to expect to, how much care you're going to need in the upcoming year, whether that be docs or therapies or hospitalizations, so that it can accurately estimate what your estimated yearly costs will be. And again, that's comprehensive. Premiums, deductibles, co-pays, co-insurance, anything that you're going to be expected to pay out of pocket is going to be in that estimated yearly cost.
Great.
Excellent. So I just want to make sure that we are ending on time. I think we have time for 2 more questions.
Yeah, I'm going to try to lightning round this last queue of questions. So one, someone is complimenting you, Paul, on your depth of knowledge.
Oh, wow.
The question is, though, can organizations reach out to you and us if they have specific questions? We absolutely, if you're an organization, especially if you're a member organization of NORD, please reach out to us. We have limited capacity to provide one-on-one help to individuals. We do our best. So we try to answer as much questions as we can, so we'll never turn people away, but sometimes we're slow to get a response. If you have individuals with insurance questions, the best people to reach out to are those navigators, our insurance brokers. If you have an HSA, yes, you can use an HSA with your exchange insurance plan.
Yep.
If you have Medicare, the best place to go is medicare.gov to find information about supplemental Medicare insurance or Medigap insurance. And finally, are subsidies based on last year's income?
No, they're based on expected income for next year.
All right. Boom, all the questions answered. Thanks,
nice
everyone.
job. Thank you so much, Paul and Tim. Again, your depth of knowledge is amazing, and you gave great presentations. Thank you so much for all the work you do on behalf of the rare disease community. If you had a question that did not get answered, please feel free to email policy@rarediseases.org, and someone on staff will follow the next week. And thanks again to our sponsor, StrongBridge, for making this timely and very important topic available to the public. And lastly, I'd like to thank all of you for joining us. Thank you, and have a good night.